Welcome to those that are joining us for today's session of YP Speaks. My name is Desiree Neufeld, and I'm a member of the Young Professionals Chronic Disease Network. So our network body launched YP Speaks this past year to provide a platform to engage with our members and friends of the community worldwide, both as a learning opportunity, but also stimulating discussion about current issues that are being faced in the arena of non-communicable diseases, as well as what work and experiences individuals have had within the field. So today's session, today marks Friday, September 4th. We're joined by YPer Seun Adebiyi. So Seun has been quite actively involved this past year in YP and our network. I was fortunate enough to meet him this past spring at a joint workshop, so Global Advocacy and Action workshop that the network launched with the American Cancer Society, and he will be leading our session today. So Seun has quite a distinctive background. He graduated from Yale Law School in May 2009. And shortly after graduating, 1 week, as well as his 26th birthday, Seun was diagnosed with lymphoma and leukemia. So his best chance at survival was a stem cell transplant. However, as a Black patient, his odds of finding a donor were quite slim. Seun then worked and helped to recruit over 10,000 donors and organized Nigeria's first ever bone marrow donor drive. He eventually received a cord blood transplant and has been in remission ever since. In 2012, Seun launched the Bone Marrow Registry in Nigeria, the first donor registry in the country, as well as the second accredited registry in Africa. This registry receives search requests from 14 countries with a 40% match rate. Seun now works as project manager with the American Cancer Society, so their global health programs, and trains other young professionals from developing countries to be effective in cancer control advocates. And as a little advocate myself for him, apparently in his spare time, he's currently training to become the first Winter Olympic athlete for Nigeria. So perhaps a discussion for another time, because that's quite something. Seun, I'll pass over the mic to you at this time, and I thank you for taking, I guess, moments out of your busy schedule to join us today.
Thanks, Desiree. Am I coming in clearly?
Yes, you are.
Okay, well, hi to everyone who is watching. My name is Seun, or Seun is the Nigerian pronunciation, but I'm American as well, so I go by Seun. This is a great opportunity for me to talk about why YPCDN is so important to me in my life. The Bone Marrow Registry story is essentially a story of YPCDN and an example of how this network has supported young professionals across the globe to achieve their dreams in spite of tremendous obstacles. So as Desiree said, I'm a cancer survivor of 5 years. I would never have imagined myself in this line of work. At the time of my diagnosis, I was working on Wall Street. And if you had asked me what I'd be doing in 5 to 10 years, I'd probably have said something along the lines of private equity or investment banking or management consulting or something in the for-profit world, but certainly not, working for a nonprofit in global health. When I was diagnosed with cancer, I'd never even heard of a bone marrow transplant. And I think a lot of people don't even know what that is. So as background, my form of leukemia was a very rare type of leukemia that really originated in the stem cells. So the stem cells that were supposed to form blood cells or lymph cells became lymphoma. And the stem cells that were supposed to create bone marrow turned into scar tissue. And the chemotherapy that is available today only targets the adult cancer cells, so it didn't get to the root of the problem. So my only chance of survival was a complete system reset and basically have someone else's healthy stem cells transplanted into my body. But in order to do that, I needed a genetically compatible donor. And that's where I ran into the social justice aspect of this issue. And this is where YPCDN is really unique in looking at the social justice aspect of health. Because basically I found that because of my race, as an African American, my odds of finding a donor were less than 20%. if I had been Caucasian, my odds would have been better than 75%. And there were two key drivers behind this discrepancy. One was the lack of minority donors on the registry. And then the other, which we really couldn't do much about, was just that Africans are genetically more diverse than Caucasians. If you think about where we all came from, in Nigeria alone, you have over 200 ethnic groups. So for me, it was like looking for a needle in a haystack. But I thought, at the very least, if I couldn't find a donor for myself, at least I could use this as a platform to raise awareness about this issue. Because the first problem of not having enough donors really pointed to a lack of awareness. A lot of people just didn't know that they could be a bone marrow donor, didn't even know what it involved. And for that, actually, bone marrow is kind of an outdated term. Most donations occur today through peripheral blood, which is exactly the same process as donating platelets. So there's either lack of information or misinformation. So I decided to hold this awareness campaign, and I was doing drives all around the country. But after several months of searching, I still couldn't find a donor, and I realized that my best chance was to hold a drive in my native country of Nigeria, which at the time didn't have a registry. I was told that this was something that was impossible. It would take 10 or 15, maybe 20 years. For someone who had a lot of experience, and I had no experience in this endeavor. But the founder of YPCDN, Sunny Kishore, and another YPCDN member, Kitty Kahana, put me in touch with two doctors in Nigeria who were based at a teaching hospital. And I told them of my plans, and they were very enthusiastic. And within 6 months, I had organized the logistics for a bone marrow drive. Now, a twist happened when, on the day I was supposed to fly to Nigeria, I got a phone call from my oncologist at Memorial Sloan Kettering. And she told me that they had just found a match for me. It wasn't an adult donor, but actually was an infant donor. They had saved the umbilical cord, and the cord blood from this healthy baby, instead of throwing it away, had been donated to a cord blood bank. And the stem cells from that cord blood were a good enough match for me. So my doctor said, it's not going to get any better than this. You basically just won the lottery. And I had to make a split-second decision of whether I should go back to the hospital and do the transplant right away, or whether I should go to Nigeria and continue with my plans of doing a donor drive. And I decided to do the donor drive because I saw an opportunity there to really make a difference in the way people, first of all, perceived the disease of cancer in Africa. And second, just because I thought it was, in a sense, meant to be. I had no family history of cancer. And, a lot of people, when they're diagnosed, they say, why me? For me, the reason personally became clear when I had this opportunity to do a drive. I said, well, if I don't do it, who will? So I went to Lagos, I held the drive, and I came back to New York, where I had a cord blood transplant. And since then, I've been cancer-free, and I've been able to live a very active life. As Desiree says, I'm currently training for the Olympics. But the experience of going through cancer and surviving and bouncing back has really changed my perspective on what's important in life. So rather than trying to be some kind of Wall Street mogul or succeeding for myself, I feel a very deep debt to not just society, but my donor, who to this day I don't know who it was. Cord blood donations are anonymous, but the fact is the blood that's flowing through my veins is 100% someone else's. And I like to kid that somewhere out there there's a 5-year-old who is my genetic twin, and I'm one of the few people to claim having 2 biological mothers, in a sense. So if I can't give back directly to my donor, the next best thing is to pay it forward. In the beginning, when I held the donor drive in Nigeria, because we didn't have a registry, I partnered with South Africa, which at the time was the only country in Africa with a bone marrow registry. And they stored our donors on their registry for 2 years. And then they said, we can't do this forever. You have to start your own registry. So that's when I decided to branch out on my own and start the Nigerian Bone Marrow Registry. And it basically just included the people who registered that first drive in 2009. And since then, the registry has slowly grown. It's still very small, We run on a shoestring budget. It's the 2 doctors that I was connected through YPCDN and myself. But despite the lack of resources, we've been able to take search requests and usually turn them around within 24 to 48 hours. So in scenarios where before people would say, sorry, you're out of luck, kind of the way I was in, now at least there's hope, there's an alternative, there's a chance. And in January of this year, we were actually able to find a donor for a cancer patient in Germany. And the donor actually turned out to be one of her siblings. The family had tried to get typed to see if they were genetically compatible, and none of the laboratories would test them. This was during sort of the aftermath of the Ebola scare, and I think everyone was just hands off. So they finally reached out to the registry, and we were able to test the family, find a sibling match, and then facilitate the travel of the sibling to Germany. So that was very validating, but I would have to say that for the most part, being an entrepreneur is something that requires a lot of self-validation. Most of the time, you'll find that people are telling you that you can't do it. It's a bad idea. It shouldn't be done, and they'll have excellent reasons that you just simply have to ignore. I think the key takeaway that I've gotten from starting this registry is that if you really believe in something, that you have to be prepared to walk alone for a good part of it. But somewhat ironically, you also have to have a very strong network. So there are parts of this journey that I've had to do alone, and then there are parts that I absolutely could not do by myself. And that's really where the strength of YPCDN comes into play, because you have this virtual community of people all around the world who are able to share experiences, insights, sometimes even opportunities. So for example, now I work for the American Cancer Society, managing a program, an advocacy program called the Global Scholars Program. And it's really about identifying the leaders of tomorrow, bringing them together, and pairing them with experienced mentors, people who've spent their entire lives in advocacy, sharing best practices, and then equipping them to go back to their home countries and fight for a difference and fight for better outcomes for cancer patients in their countries. And we were able to identify our pilot class of global scholars through the YPCDN network. We had 2 scholars from Kenya, 1 from Nigeria, 1 from India, and 1 from Rwanda. And they are currently in the process. They completed a training that Desiree and I went to in March at Harvard School of Public Health. And now they are in the process of applying for grants to do advocacy campaigns that will improve the lives of cancer patients in their countries. So YPCDN has really been a central part of my story to date, and it continues to be an integral part of what I'm doing going forward. My plans for the future of the Bone Marrow Registry is to continue to expand it. The biggest hurdle to overcome right now is actually financial, because it costs about $100 per person to do the genetic testing. And when you're talking of a continent where in some cases, a lot of people don't live on $100 a year or less, it's very difficult to fundraise for that. So I've been looking for investors and really making this argument of, this is a social justice issue. One's race should not determine one's chances of surviving a chronic disease. And bone marrow transplant is not just for cancer. It can actually cure over 70 diseases and counting. So besides the social justice aspect, there's also the fact that over half the transplants today occur between patients and donors who are living in different countries. So the world's really becoming a much smaller place. So I would like to see the registry actually become a Pan-African registry where you have donors from all different countries. And these countries might not have the resources independently to start their registry, but if you're able to find people within those countries who are passionate about the same issue, we can collaborate. And since Nigeria has the infrastructure, it's fairly easy to add on to that. So in a sense, I'm leveraging the YP model of building networks and building bridges to collectively achieve outcomes. So that's my story. We have about 15 minutes. I'll hand it back to Desiree and see if there are any questions.
Thank you very much for that, Sean. It's quite a fascinating story, and I love the, isolating your experience moving from start to finish, and what issues arise on this journey, yours personally as well as what others will encounter. Also, great to give voice to the fact that no country is self-reliant or self-sufficient, even in terms of bone registries and the need for that collaboration. We do have a handful of viewers watching, so I'll open up the floor now and provide opportunity for questions to be submitted, either through our question and answer box that's enabled on our event page, or by Twitter at the Twitter handle at NCD-Action. So Sean, perhaps you and I can continue chatting in the meantime and give opportunity for those to warm up in discussion. As part of your work with the American Cancer Society and YPCDN, would you be able to speak to the upcoming training and workshop that's going to take place in November, or is that a little too early to bring up such a subject?
So the Global Scholars Program is a combination of training and then actual implementation of advocacy projects. So we held our first training workshop in Boston. We had about 30 young professionals from all over the world. And we're doing a second training in Morocco around the African Organization for Research and Training in Cancer. That's a mouthful, so we call it AORTIC for short. And it's a global conference that brings together researchers, academics, policymakers, and advocates from all different fields of oncology. And it's really about tackling the rise of cancer in Africa. A lot of people associate the global health challenges in Africa with infectious diseases, but in fact, in the future, the biggest challenge is going to come from the non-communicable diseases. As lifestyles are changing, and as people are surviving infectious diseases like HIV, tuberculosis, and malaria, the primary causes of morbidity and mortality are shifting more and more to non-communicable diseases. So at this conference that's bringing together experts at the forefront of cancer, we're really going to be looking at best practices, evidence-based interventions, and low-cost solutions to stem the rising tide of morbidity and mortality from NCDs. And one day before the conference starts, we're going to have a full-day workshop that's really focused specifically on young professionals and giving them the tools, the advocacy tools that they need to make real changes in the lives of cancer patients in their country. So it's going to be a full-day workshop. Up to 5 people are going to get travel scholarships, but the workshop is open to anyone who is coming to the AORTIC conference.
That's great. I see some movement, but no questions yet. So I'll start off and warm us up. As you spoke to financial constraints being one of the biggest barriers, and even leading up to the conference and the training in Morocco for low cost or I guess more feasible or effective solutions that can be utilized by populations that don't really have the luxury or the spare income to donate to specialized medicines. Is there anything that stands out to you in terms of your research or readings that, I guess from the start in 2009 to what you see now, the growth in that area, both financially or even treatment-wise?
Yeah, well, my story is not, I mean, the story of the registry is very similar to that of many other registries. In fact, the United States, which has the largest registry in the world, 10 million donors, was started by a family who was very much in the same predicament as I was, looking for a donor for one of their family members. And today, it's grown into an organization that is supported both at the federal level and as well as by volunteers and donors. And it's this massive organization, but it got its start as just, a very small endeavor for a single individual. And the same story repeats itself in the United Kingdom, which has a very large registry, and so on. I think that with the emphasis of ministries of health just now starting to turn away from infectious diseases to non-communicable diseases, there is an opportunity to look to see how we can leverage that to support these kinds of interventions. But in the meantime, it really does rely a lot on volunteer donors, and that in turn requires awareness. So a lot of my activities is just involved in raising awareness, especially among diaspora communities. That's probably the biggest eye-opener, that when I talk about lack of funding, it's not as if there's not money out there. The African diaspora spends or sends a tremendous amount of money to the continent, but that money is not being channeled in the direction of chronic diseases or interventions for them. So I think what a big challenge for me is getting in touch with the diaspora and helping them make the connection that a bone marrow registry in Nigeria or Ghana is not just for patients living in Nigeria or Ghana. There's a very real likelihood that the person whose lives is saved might live in the city next to yours here in the United States. This is really a international movement. And in fact, the people who stand most to benefit are probably those in the diaspora who have access, like I did, to a lot of treatments, chemotherapy, and so on, but they don't have donors. And in Africa, you have a lot of donors, but you don't have access to treatment. So there's almost this one hand has what the other hand needs, and both hands need to work together.
That's great. Now, if for someone looking who will be watching the video, perhaps retrospectively, is there any advice you would have for action moving forward, how they could get involved, or both with, I guess, the American Cancer Society, the network, or the training in Morocco up and coming?
Yeah, I mean, if someone is going to the training in Morocco, I would definitely urge them to reach out to me on Twitter or email me, and we can send out my email after the call if people are interested. I would also encourage them to stay involved with YPCDN. There are a lot of opportunities to just pop up sporadically, and it's a great resource. It's a way to stay sort of connected. And then if people want to get involved directly with the registry, again, that's something a lot of people have reached out and said, well, how do I start a registry in my country? And it really honestly just takes a lot of determination. I mean, that's more than money or resources. It takes a lot of determination. There are the people who will find you, but you'll have to go through a lot of no's before you get to that first yes. In terms of practical terms, what you really need is a hospital or some place where you can get people together and educate them about what bone marrow transplantation is. And what I found is when I actually explain what the process was, 100% of the people I've talked to in Nigeria have wanted to become donors. So once you get past the education, then it becomes a logistical challenge, which is something that I've been able to overcome using international partners. So the infrastructure of the registry is partly managed by a company based in the Czech Republic. And when we were working to get this donor in Germany, we had partners in the United States and South Africa and so on. So that's the part where I said it's very important to have a strong network. And YPCDN is a great way to get that network. That's how this whole thing started, with my connections through YPCDN. So I would definitely say stay involved with YPCDN, and then continue to expand your network through conferences and so on.
Awesome. Now, more silence than I'd like, but I'll take this opportunity to thank you for joining us today for YP Speaks. For those that want to also visit this session, watch it again, as well as those that have been completed recently, feel free to visit our website and the YP Speaks page there. We can also be reached on Twitter at NCD Action, and can happily facilitate contact with Sean hereafter, should you have questions to follow up on. So thank you, Sean, again for joining us today, and I'll look forward to the momentum that this conversation has moving forward, and the seeds that it will continue to plant.
Thank you.
Okay. And for those tuning in for upcoming YP Speaks, we have another session coming up at the end of the month. Dr. Kremlin will be joining us to discuss how to generate evidence to, I guess, prove linkages between NCDs, poverty, and development. So thank you again.